Driving under the influence of prescription and OTC drugs, Part 1. The ability of a substance to endanger your health, produce intoxication, or make you a risky driver has very little to do with whether or not it is lawful. Many over-the-counter, OTC, and prescription medications can have side effects that make it unsafe for you to drive. Furthermore, many legal medications have the potential to be fatal when used excessively or for an extended period of time. Any medication taken otherwise than as prescribed by your doctor, pharmacist, or the prescription's instruction sheet can have a number of serious side effects. Even following pharmaceutical instructions to the letter in some situations can result in unexpected side effects that make a person unfit to operate a motor vehicle. For instance, certain drugs may result in 1. Drowsiness 2. Double or blurry vision 3. Sensitivity to light 4. Large limbs 5. Nausea 6. Restlessness 7. Focus issues. There is still a significant risk of driving impairment when taking several popular medications, despite the rigorous standards governing the authorized drug compositions used in prescription and OTC pharmaceuticals. Be cautious of the following medications. 1. Medications prescribed for anxiety 2. Antidepressants 3. Any product containing codeine 4. Anti-allergy drugs 5. Anti-influenza medications 6. Cough suppressants 7. Pain relievers 8. Tranquilizers 9. Stimulants and diet pills. Legal medicines may be somewhat safer than illicit ones, but they can never be completely secure. The issue is that it is challenging to forecast precisely how a medicine will operate because it depends on a number of variables. The degree of impairment a patient will experience while taking a medicine depends on their dosage, diet, lifestyle, and genetic makeup. One individual may be entirely fit to drive while using a certain drug, whilst another person may be completely unfit to drive while using the same dose of the same drug. For this reason, even if your doctor has advised you that you should be fine to drive, it is crucial that you pay attention to your own mental and physical health when taking any drug that has the potential to impair driving ability. In the event that you cause harm to or the death of another person while operating a motor vehicle while under the influence of a legal substance, you alone will be held accountable, not your doctor. DUI, OTC drugs, and prescription drugs. You could be charged with DUI or DWI if your driving is significantly affected and it is discovered that you are under the influence of several OTC and prescription medications, just like you would be if you were driving while intoxicated by alcohol or an illicit substance. Legal and illicit drugs are treated equally under the law in the majority of states when it comes to DUI trials. Carry the prescriptions for any medications you take while driving if you want to avoid legal ramifications. If a police officer pulls you over and discovers prescription drugs in your car, they might ask you to provide them these papers. The risks of taking pharmaceutical drugs. When taken carelessly, prescription drugs are particularly risky. Keep in mind that many prescribed medications are produced with small amounts of illegal narcotics and can be quite dangerous. Codeine, a typical analgesic, is an opiate, similar to heroin in its biological mechanics and physical effects. Unfortunately, people are frequently unaware of the risks associated with using prescription medicines because of their legal status. Despite the fact that prescribed medications have legitimate medical uses, they are nonetheless just as deadly as illicit substances. In actuality, many prescription medications pose a comparable risk of physical or mental dependence and abuse as illicit narcotics with no accepted medical value. They are given because a medical professional thinks the benefits of using the medication outweigh the risks. This does not imply that they cannot harm a person's health or leave them incapable of operating a vehicle, particularly if the patient does not take the medication as directed. Long-term usage of addictive prescription medicines can swiftly cause the patient's dependence on the drug to outweigh any duty they feel to use it responsibly or worries they may have for their own health. Over 53% of the 41,502 overdose deaths that occurred in the United States in 2012 were attributed to prescription medications that are entirely legal. Prescription drug classes that are among the most hazardous and often abused are as follows. Opioids, drug that lowers central nervous system, CNS. Brain stimulants, let's speak about the dangers of utilizing these medications and how they can affect your ability to drive. Opioid-based prescription drugs are typically used to manage chronic pain, which may or may not be related to other health issues. All around the United States, a huge selection of these opioid painkillers with slightly diverse effects and applications are available by prescription. Over the past 2 decades, our country's addiction on opiate painkillers has gradually increased and shows no signs of abating. Opioid painkillers were prescribed 259 million times in the United States in 2012. This is equivalent to giving each adult in the US a bottle of pills worth of medication. Here are a few of the most often used drugs. Frequently prescribed opioids. Morphine. Alleviation from moderate to severe pain. Codeine. Alleviation from moderate to severe pain. Less powerful than morphine and less sedative in nature. Methadone. Addiction treatment for heroin. Oxycodone. Stronger muscle relaxing effects with twice the potency of morphine for severe pain relief. Fentanyl. 80 to 100 times more effective than morphine for the treatment of extreme pain. Meperidine, propoxyphene, hydrocodone, hydromorphone, and oxymorphone are some further common opioid-derived painkillers. All of these medicines have a high potential for physical dependence and misuse, which is an undesirable side effect. Additionally, they may result in delayed breathing, a dangerously low heart rate, a coma, and even death. When opioid painkillers are used with CNS depressants or alcohol, the likelihood of these more severe side effects drastically rises. Even at the appropriate dosage, taking any opioid painkiller has the following short-term side effects. 1. Extreme sleepiness. 2. Muscle tremor. 3. Dizziness. 4. Confusion. 5. A lack of cooperation. 6. Nausea. 7. Itching. Driving under the influence of prescription and OTC drugs, Part 2. Opioid prescriptions and your ability to drive. Opioids are known to make people sleepy and impair their capacity to reason. The data we do have suggests that driving while under the influence of any opioid can double the risk of being in an accident, despite the fact that there have been very few research specifically investigating the effects of opioid painkillers on driving abilities. Opioid painkillers can cause impairment even at relatively modest dosages, however, this varies from person to person. Although the biological causes and medicinal uses of all opioid medications vary significantly, the effects on impairment are generally similar and will probably include drowsiness, mental confusion, and impaired coordination. These negative impacts might have disastrous results while operating a vehicle. Opioid usage impairs one's ability to focus on the road, making it more likely that they may miss crucial visual cues like traffic signals, other drivers, and imminent changes to the road structure. Additionally, they could struggle to stay awake and have microsleeps. Opioid intoxication's physical side effects make it easy to move carelessly. When provided with opportunities to slow down or stop, someone under the influence of an opioid will have a slower overall reaction time and might not apply the brakes in time. They could turn excessively wildly or veer off the road due to poor steering control. Depressants for the central nervous system. For sleep difficulties, anxiety, panic attacks, seizures, restless leg syndrome, and a number of other diseases, doctors frequently prescribe depressants including barbiturates, benzodiazepines, and Z-drugs, non-benzodiazepines having comparable effects. Due to the fact that many of these medicines can lead to physical dependence and psychological addiction, they are carefully regulated and only available with a prescription. When used improperly or in combination with alcohol, some medications have a substantial risk of overdosing. Benzodiazepines. One of the pharmacological classes that is most frequently prescribed in the U.S. is the benzodiazepine family. In addition, they are among the most often abused. 30.6 million adults in the United States took benzodiazepines between 2015 and 2016, according to data from the National Survey on Drug Use and Health. Only 25.3 million of those people had valid prescriptions for the medication, and 5.3 million misused it after obtaining it illegally. These benzodiazepines are some of the most popular ones. Common benzodiazepines on prescription: alprazolam, Xanax, chlordiazepoxide, Librium, clorazepate, Transine, Estazolam, temazepam, Restoril, diazepam, Valium, Triazolam, Apotriazo, Halcione, Hypam or Trilam. Benzodiazepines are potent sedatives that may cause unpleasant side effects to manifest right away. Depending on tolerance, genetics, and other factors, different people will experience these adverse effects at different doses. They consist of drowsiness, confusion, dizziness, shaking, a lack of cooperation, distorted vision, extreme lassitude, headaches. Barbiturates. Barbiturates have effects that are comparable to those of benzodiazepines, although they are administered less commonly since it is believed that they are more likely to cause adverse effects, abuse, and overdose. The following is a list of some popular barbiturates. Frequently prescribed barbiturates: phenobarbital, seconal, nembutyl butabarbital. Barbiturates are infrequently given for anxiety and sleep disorders, in contrast to benzodiazepines. The treatment of epilepsy, seizures, head injuries, convulsions, and severe migraines is where they are most frequently utilized. Drowsiness and nausea are the negative effects of using barbiturates that occur most frequently. However, patients might also go through large muscles, ineffective coordination, bad headaches, confusion, loss of memory, slowed breathing. Z-drugs. Non-benzodiazepine depressants known as Z-drugs are frequently administered to treat sleep disturbances. Since all of their names either start with the letter Z or contain it, they are known as Z-drugs. The following is a list of some well-known pharmaceuticals in this class. Frequently prescribed Z-drugs: S-zopiclone, Lunesta, Zaloplan, Sonata, Zolpidem, Ambien, Zopiclone. The majority of Z-drugs have a far stronger sedative effect than other CNS depressants but do not have the same anti-anxiety effects. These medications' adverse effects can include headache, mouthache, a lack of cooperation, faulty judgment, hallucinations, no memory, daytime slumber, confusion. Sleepwalking, sleep eating, and even sleep driving are examples of complex sleep behaviors. Driving under the influence of prescription and OTC drugs, Part 3. Driving ability and prescription CNS depressants. The central nervous system is slowed down by all depressive drugs. Every medication in this class has the potential to result in significant sleepiness, delayed movements, and decreased cognition, albeit the side effects differ from drug to drug. Even when these side effects are minor, they greatly increase your chance of falling asleep at the wheel or missing crucial details about the traffic situation. Additionally, because of the slowed reaction time, you can find it difficult to adapt to changes in the road environment in time to prevent collisions and confrontations. Z-drugs have a reputation for substantially affecting a driver's ability to drive, even when only minute amounts of the drug are present in their system. It can be particularly challenging for a patient to decide if they can safely operate a vehicle because these medications frequently have a delayed impact. Unsurprisingly, one of the most frequently discovered substances in drivers who have been detained for driving while under the influence of narcotics is Zolpidem, which is routinely prescribed. Stimulants for the central nervous system. Attention deficit hyperactivity disorder, ADHD, chronic fatigue, morbid obesity, narcolepsy, and severe depression are all routinely treated with prescription CNS stimulants. After just a few usage, many strong stimulants can lead to physical addiction and psychological dependence. Unfortunately, due to the temporary high-end energy boost they offer, prescription CNS stimulants are commonly misused. Most stimulants are quickly tolerized by patients, requiring progressively greater doses to produce the same early effects. The following is a list of some of the most popular CNS stimulants. Typical CNS stimulants: dextroamphetamine, dexedrine, amphetamine and dextroamphetamine mixed, Adderall, methylphenidate, Ritalin or Concerta, methamphetamine, Digoxin. More than 16 million Americans over the age of 18 were discovered to be using prescription stimulants, according to a 2016 research by the American Journal of Psychiatry. Data from the same paper also raises the alarming possibility that 5 million Americans are abusing prescription stimulants for weight loss and performance enhancement, with Adderall being one of the most widely utilized examples. The following are a few impacts of prescribed stimulants: dizziness, insomnia, elevated blood pressure, rapid, shallow breathing, irritability, depression, anxiety, paranoia, headaches, spasms of muscles, tremors, manic episodes and mood swings. Driving ability and premium CNS stimulants. The National Highway Traffic Safety Administration's research demonstrates that little doses of CNS stimulants, such as amphetamines, can increase drivers' alertness and quickness of reaction. Unfortunately, the study's relatively low doses also increase drivers' propensity to act recklessly or riskily when operating a vehicle. The marginally beneficial effects of CNS stimulants on driving ability vanished at larger doses and were replaced by markedly unfavorable ones. High amounts of stimulants cause drivers to lose focus, react slowly, have difficulty controlling their muscles, have poor motor skills, feel more anxious, and take longer to react overall. Stimulant abuse, such as utilizing Adderall, Concerta, or Dexedrine, can lead to risky driving habits. These drugs frequently cause people to drive recklessly, disrespect traffic signs and signals, go too fast, and fail to maintain a safe following distance. Over-the-counter, OTC, medicine hazards. You don't need a prescription to get a lot of pharmaceuticals and generic medications. Certain pharmaceuticals may occasionally have age restrictions or caps on the quantity that one person can buy at a time. Drugs that are sold without a prescription often have a very minimal risk of addiction and abuse. They frequently do include addictive and dangerous medicines, but only in little, safe dosages. Without a prescription, you can get cough suppressants, painkillers, allergy medications, stomach acid reducers, and moderate sedatives. OTC medications can nevertheless have unfavorable side effects that can have a negative influence on your health and ability to drive safely, despite the fact that they are typically less risky than prescription-only medications. Serious adverse effects often only happen when OTC medications are taken in extremely high amounts. However, if a person is sensitive to a certain chemical, they could experience negative effects even at relatively modest levels. Never exceed the maximum dose specified on the packet of any OTC medication you are using. Always read the label. Keep in mind that every person reacts to medications differently. Even though the directions on the packet say you can drive while using the medication, be sure you're in good physical and mental health first. Whenever possible, look for an alternate mode of transportation. Driving under the influence of prescription and OTC drugs, Part 4. Let's look at some common over-the-counter drugs' probable side effects. Pain relievers. Aspirin, Tylenol, and Advil are examples of low-strength painkillers that can be acquired without a prescription. These medications can ease the discomfort brought on by headaches, muscle pains, dental issues, and minor joint pain. Additionally, they can be used to lower fever in persons with the flu and other viral diseases. OTC painkillers are generally harmless, but they can be dangerous if used excessively or for a long time. Blood thinning, an increased risk of heart disease, heart attack, and stroke, liver damage, stomach lining degradation, and light sensitivity are some of the long-term health hazards connected with these medications. Any pain reliever that has a suggested dosage might be lethal if taken in excess. While significant negative side effects from over-the-counter painkillers are uncommon, mild negative side effects are rather prevalent and can easily impair your ability to drive. Adverse effects of over-the-counter painkillers include drowsiness, headaches, stomach pain, nausea, vision problems. Any unpleasant side effects would make it harder for you to fully focus on the driving activity and would raise the likelihood that you would crash your car. Before getting behind the wheel, always wait for painkillers to take effect to ensure that they won't impair your ability to drive safely. Antihistamines. Antihistamines are a class of histamine-blocking medication that reduces the inflammatory reaction of your body to allergens like pollen, pet hair, and dust. They can be used to treat cold and flu symptoms due to their anti-inflammatory properties. Several well-known OTC antihistamines include Vanafen, Silodril, Benadryl, Unisom, and Chlorotrimazole. If you need to drive or handle heavy machinery, you should use antihistamines cautiously because many of them have a strong sedative effect. Additional negative effects include muscle tremor, anxiety or jitters, dizziness, nausea, restlessness, vision problems, in severe cases. Antihistamines can have physical and mental side effects, so it's crucial to know how you'll feel before deciding to drive while taking them. The most frequent adverse effects include restlessness, anxiety, and anxiousness. These impacts may influence how you make judgments while driving, make you more impatient, and make you more likely to drive aggressively even in circumstances that are mild enough not to be immediately visible. Keep in mind that antihistamines frequently make other medicines and substances, such as alcohol, more powerful. When using antihistamines and even a modest amount of alcohol, you can find yourself suddenly becoming severely impaired. Cough syrup. The majority of over-the-counter cough medications, including Robitussin and Nyquil, include the hallucinogenic substance dextromethorphan as its active component. When consumed, it produces a comparable chemical response to PCP. There is hardly any of this medication in over-the-counter cough medications. Without producing unfavorable side effects, it is sufficient to produce positive expectorant and cough-relieving benefits. The amount of dextromethorphan you consume may rise if you take any cough treatment in excess of the authorized dosage, which could have adverse effects. For example, dextromethorphan has been linked to hallucinations, focused deficit seizures, a fictitious sense of security, violent conduct. Driving while experiencing any of these conditions might result in very risky conduct. Remember that dextromethorphan and alcohol together have a stronger effect. When taking over-the-counter cough medications, never consume alcohol and always take the prescribed dosage. Before starting any travel while taking a prescription that contains dextromethorphan, be sure you are both physically and emotionally prepared to drive. Risks associated with medication interactions. All drugs, prescription, over-the-counter, and illicit, have a chemical reaction in the body that causes both mental and physical effects. A person taking 2 or more medications at once may have drug interactions, which could result in a different chemical reaction and thus, different outcomes. It's crucial to remember that just because a drug often doesn't make you unable to drive, doesn't guarantee it will be similarly safe when used alongside another medication. Before taking 2 medications at the same time, always with your doctor or pharmacist. Combining drugs can have major negative effects on your health in addition to making it risky for you to drive.